introduce yourself, one sentence elevator pitch on what you do, and how is your work differentiated and uniquely making an impact in behavioral health?
Thanks, Salome. Hi, everyone. My name's Adam Hutchinson. I'm the founder of oVRcome. There are 301 million people around the world that have a mental health condition that needs exposure therapy as part of their intervention. But unfortunately, 80% of them receive no treatment whatsoever. And this is due to cost of current treatment, location for many people are in a rural area. There's a stigma, particularly for men. And there's also massive waiting lists around the world to access this treatment. What oVRcome does is deliver virtual reality exposure therapy via a direct-to-consumer channel via their smartphone. It's safe, data-driven, we're now clinically effective, and best of all, it's incredibly scalable, and that's our real focus with oVRcome is scale, getting this technology and treatment into the hands of the people that absolutely need it. We know that the people that do need this treatment, they can't access it, and that's what we're really going after to solve, is around the accessibility of this treatment. What differentiates us is our knowledge of the problem. I was personally diagnosed with social anxiety disorder when I was a teenager. I've been through the treatment. I know the problem well, and with my background in technology, I'm able to solve this problem in a really unique way. We are clinically proven, which is, we've been through a clinical trial with the University of Otago where we showed on average there was a 75% reduction in the severity of someone's phobia after 6 weeks of treatment. For the next 12 months, we're really excited about launching our new partnership with the NHS in the UK, helping children and adults with autism to experience hospital environments. Later this month, we are launching our new B2B channel, which is a clinician portal for clinicians to be able to get access to our huge library of VR content. We are learning from those decisions that are getting made so we can personalize treatment for our direct-to-consumer users that cannot afford to see a clinician. So they're getting really good decisions made for their treatment pathway. So super excited, and thank you for the opportunity.
I think we all have seen that this category has been tricky for a lot of reasons. It's a very tough one from a regulatory perspective. It's very easy to do something that kind of runs afoul of I think in some cases the FTC and other agencies where we've recently kind of seen a lot of this play out. So what are you all doing to ensure that you are providing that convenience and ease of use that's so important to your patients, while also having really strong kind of clinical independence and making sure your clinical teams feel that they can administer the type of care that they see fit, and then managing the expectations of VCs at the same time?
I think the only other thing that I could add there, I agree with everything that's been said so far, but just making sure that the internal teams are aligned in the goal, which is around, making accessible, clinically safe interventions. And so as long as everyone's on the same page with what we're trying to do, I think, we can all, achieve the same outcome. The clinical team is working with the UX team is working with the dev team, and we're all working towards that same goal.
Do you think AI is overhyped, underhyped, just hyped enough when it comes to, your particular category or company?
Sorry, we've got a really interesting use case with oVRcome for AI, and it's the development of exposure hierarchies, which ultimately gets the best outcome. We're training that model off our new clinician portal, which basically means that all the people that can't afford to see a clinician and get those decisions made for them can actually have them made through this algorithm. So really interesting. The focus is on getting the best outcome from that individual by personalizing these programs for them. So yeah, it's really interesting, and we're excited about the opportunity for the use of AI.